we start?
Hello, everyone. Thank you so much for the kind introduction, and a big thank you to MSAI for inviting me to this workshop. It's a real honor to be here with you all at the CATALYsT workshop today. I have immense respect for the work you're doing as future healthcare professionals who understand that human health and health of our planet are deeply connected. So I'd like to start with saying that climate change is not just an environmental issue. It's a public health crisis as well. So as medical students, you have the potential to become powerful advocates for both shaping individual behaviors and influencing systematic change. So we often hear that young people are the future, but I believe more than ever that we're also the present. Youth voices have become a great influence in the climate movement. We've seen young leaders all over the world rallying their communities, pressurizing governments to create systematic change, and pushing for corporate responsibility. But here's the big question: how can we make sure that our advocacy leads to real and lasting change? First, it's important to recognize that being a strong advocate isn't just about speaking out or being outspoken. It's truly understanding the systems we're trying to change, building partnerships, collaboration, and developing strategies that create long term effect. So, in order to be effective, we must be both informed and strategic. That's how we move from just making noise to creating real, meaningful, and impactful change. So, I'd move on to explaining how climate change and the health sector are interconnected. So, as medical students, you are advantageously positioned to be key players in the fight against climate change. And I'll explain how. The link between climate change and public health is undeniable. Air pollution contributes to respiratory diseases, heat waves increase cases of heart stroke, and rising temperatures affect food security and even mental health. So these challenges aren't just future problems, they're happening now. And they're disproportionately impacting the most vulnerable communities in our world. So, you, as future healthcare professionals, will be on the front lines of these impacts. But your role can go beyond just treating the symptoms. You have the chance to address the root causes by advocating for climate resilient health systems and policies that prioritize the well being of these communities. You can help ensure that public health becomes a key part of climate discussions. Air pollution alone contributes to a range of respiratory diseases, from asthma to chronic obstructive pulmonary diseases, increasing conditions that millions of people suffer from day by day. But it doesn't stop there. The increasing frequency and intensity of heat waves lead to more cases of heat stroke, dehydration, and other heat related illnesses, especially in vulnerable populations such as the elderly and children. Rising global temperatures and shifting weather patterns are also compromising the food security problem, which in turn worsens malnutrition and weakens immune systems, making populations more susceptible to diseases. And let's not overlook the mental health toll. The anxiety and stress associated with living through climate related disasters and witnessing environmental degradation, suffering from eco anxiety uh, can be an example for this. These challenges are not just hypothetical or future scenarios. They're happening right now and on a large scale. and they're disproportionately affecting the most marginalized and vulnerable communities, especially people in the global south. The reality is that the people who contribute the least to global emissions are often the ones bearing the heaviest burden of climate change. This is clearly an injustice, and it's one that we as a society, and you all particularly as healthcare professionals, must confront. As future doctors, nurses, and health practitioners, you will be the front lines treating the symptoms of the climate crisis. But your role, and it should go beyond that. You have the chance to address the root causes to move upstream in the fight through advocacy for climate resilient health systems, systems that can withstand and adapt to the impacts of climate change. You can protect both patients and the broader communities you serve. You can support policies that prioritize public health in climate discussions, as it was previously being discussions, the climate conferences. You all have already explained all of that. So whether it's pushing for cleaner energy solutions to reduce air pollution, advocating for urban planning that mitigates heat islands and cities, or ensuring that healthcare facilities are prepared for extreme weather events. Your voice is important in shaping a future where health and climate are seen deeply interconnected. And don't underestimate the influence you can have. As members of the medical community, your expertise is trusted. People listen when you speak because you are in a powerful position to push for change, to inform public policy, and to ensure that health becomes a central pillar in the climate movement. Your advocacy can also help shift the narrative from seeing climate change as an environmental issue to recognizing that it's a public health emergency. The climate crisis is at its core a health crisis. And as leaders, you are not just tasked with treating illnesses, you're tasked with shaping a future which is healthier and more equitable. The work begins now, and your role in this fight has never been more crucial. So, as you continue your trainings, your medical training, I encourage you to think about the broader context in which you will be practicing. Understand that health of your future patients is directly tied to the health of our planet. And remember that in your hands, you have the tools to not only heal, but to advocate, to lead, and to make lasting systematic change. The intersection of climate health is where your work, your passion, and your future can cover for the greater good. I'd like to give you an example of the work that I am doing at Ecovita, my impact venture. We've been working to bridge the gap between health and sustainability by promoting organic, locally sourced food options that support both environmental and well-being and healthier diets. But we're also working to shift mindsets through education and community outreach. We're raising awareness about the importance of climate conscious foods and advocating for food systems that prioritize sustainability. We're also currently working on creating an AI tool, uh, which I can't talk more about it right now. So we're working on an intersectionality of making healthier food more accessible to vulnerable communities through that. So what comes next is I would love to explain the power of education in climate advocacy. Education is at the heart of impactful advocacy. in order to inspire action, people need to first understand the scope of the problem and the solutions available. Climate change often feels distant and abstract, but through education, we can help people see its direct impact on their lives, their health, and their future. As students, your role in this education process is can't even I can't even explain how important it is. So the health impacts of climate change are some of the most immediate and personal aspects of this crisis. So through becoming climate educators, you can help your peers, patients, and even your community to grasp the seriousness of this issue and empower them to make more informed and sustainable choices. So at Climate Conservancy, the nonprofit I founded, this belief in climate education is central to our mission. We work to make climate education accessible to people around the world. So uh, we make information more accessible to vulnerable communities because they have the right to know why they are facing these sudden disasters. So our goal is to equip individuals, especially young people, with the tools and knowledge they need to become climate educators and conservationists in their own communities. We also work on the intersectionality of climate change and local concerns like health, gender equality, education, conservation, and other UN sustainable development goals. I'm sure by now you all might be aware about what UN sustainable development goals are. And I'd like to share another example, like an advocacy action you all can take. One of the most impactful initiatives at Climate Conservancy is our chapters program. This program allows passionate individuals like you all to establish local chapters in your universities or regions. These chapters serve as hubs for climate education and action, where you can organize events, lead projects, and spark conversations around sustainability and climate resilience. Starting a chapter is simple, but the impact can be immense. Each chapter creates a ripple effect. Every person you educate and inspire to take climate action is one more person working towards a healthier planet. You don't have to wait for permission for everything to be perfect before starting. Many of our chapters began with just a small group of students who wanted to make a difference. With guidance and resources from us, you can launch impactful initiatives that address climate challenges in your community, from cleanup drives to policy and advocacy campaigns. If this resonates with you, I encourage you to consider starting one at your universities or in your regions. We offer support in the form of educational resources, leadership training, campaign guides, and a connection to a global network of young climate advocates. As medical students, you can bring a unique perspective to the table, especially in highlighting the intersection of climate change and public health. You could focus on climate-related health issues, advocate for sustainable healthcare practices, or help make your medical institutions more climate resilient. Not only would you be contributing to the fight against climate change, but you'd also be developing valuable leadership skills that will serve you in your future careers. So, as medical students, you can advocate for climate conscious practices. You can push for sustainable changes in healthcare institutions, reduce waste, and particularly rarely by that, I mean healthcare waste, and advocate for policies that prioritize both patient and planetary health. Um, Individual action is important, but I always say collective action is how we create large scale change. And I believe that systematic change is more effective than individual action. But as future leaders, you already have the skills to lead. Climate change also requires collaborations across youth advocates, civil society, governments, and industries. You will often find yourselves in conversations with people who may not fully understand the urgency of the climate crisis. So, in these moments, your role as leaders is to bridge the gaps, create understanding, and encourage collaboration. So, climate change disproportionately affect vulnerable populations, especially in displaced communities and developing countries where access to resources is often limited. It's particularly in the global south region. So youth can play an important role in building climate resilience by promoting local solutions, engaging in community-led initiatives. You all can create sustainable agricultural practices, advocate for resilient infrastructure, and create awareness around the climate risks. Youth led projects can also amplify marginalized voices, ensuring that adaptation strategies are inclusive and responsive to the real world needs in their communities. Their involvement bridges the gap between innovations and grassroots action, which can help build a future where communities survive amidst these major challenges. So, besides all this, it's really important to discuss what are the main skills that youth need to develop for effective climate advocacy. So, to be successful climate advocates, there are certain skills you need to develop. And the first one is my favorite one, it's storytelling. So, sharing personal stories about how climate change affects people's health, how it might have affected you in some point of time. Um, and this makes the crisis more understandable, relatable, and it also humanizes the issue. And another one would be policy literacy. It's really important to advocate for sustainable policies because it is the only option that how you can advocate for systematic change. So, understanding policy processes would be the first step to creating long lasting change. So, this skill must be developed before you attend the conferences that we talked about in the previous session as well. So, learn how to engage with policymakers and draft policy proposals that address both health and climate concerns. And the third skill is not only important in this field, but any field you choose to move on to in your life. So it's networking. But it's really important in the social sector and definitely in the climate space. So building strong relationships with other advocates, organizations, and policymakers will it won't just amplify your impact, but it will also help you grab onto more opportunities in this space. And lastly, leadership is an important skill for this space, whether you're leading a project or organizing an event, coordinating a campaign, or managing a crisis.
Leena, we're very sorry to interrupt, but I think there's some problem with the internet. You're not very audible.
Leadership skills will be essential in sustainability. So as we look into the future, one of the
I think we have some connectivity issue.
okay, am I audible now?
Yeah, you're audible, but you're not visible. So I
Your
think
feed is frozen, yes.
start your video once and we'll see once again.
If by the time Lena joins us again, just quickly going over all the things that she's discussed, right from the steps that we can take as individuals, not just as healthcare, like future healthcare physicians and doctors and clinicians. She has gone right from the steps we can take in our individual lifestyles to the various advocacy methods that exist, especially in the healthcare spaces. She's gone on to talk about technology and how it can be integrated, especially she spoke about AI and how that can also be integrated to further the cause of sustainability and just climate advocacy. And additionally, she also spoke about the vulnerability. And one very key word she mentioned was intersection. Intersection, as in the fact that it is not just class or sort of caste or any sort of all the various determinants of health overlap with each other to decide where we stand. And the vulnerabilities of populations are determined by that. So it's all been covered very well by her. We encourage all our participants to write down any questions that they may have, drop them in the chat box, or you can send them to us on our group on WhatsApp. And yes, Lena, are you back? Is it better?
Yeah,
All right.
yeah. Am I audible now?
Yes, yes, you're audible.
Okay, so very beautifully summarized by Aradhana, which reminds me that active listening is also one of the skills that are needed to develop before attending these conferences.
Agreed.
So, uh, coming back to what I was talking about. So, as we look into the future, one of the most exciting and necessary innovations lies at the intersection of healthcare and sustainability. The healthcare industry well-being is also one of the largest contributors to environmental degradation. As you all might know, as an example, what from the healthcare industry. At that moment, we didn't have more sustainable options to single-use plastics. From energy intensive hospitals to single use plastics, the healthcare sector has a significant environmental footprint. But it also presents a tremendous opportunity for a change. In the coming years, we are likely to see a rise in the climate resilient healthcare systems, hospitals, and even clinics that not only reduce their environmental impact, but also adapt to the challenges posed by the climate change. So these systems will prioritize energy efficiency, waste reduction, and sustainable procurement practices. They'll also be designed to withstand the increasing threats of climate induced disasters like floods, heat waves, wildfires, and ensuring that healthcare remains accessible even during these climate catastrophes. Another trend is sustainable medical practices, including the development of eco friendly alternatives to commonly used materials. Researchers are exploring biodegradable or reusable medical supplies that can replace the current reliance on single use plastics. And some hospitals are beginning to adopt sustainable energy sources like solar power to reduce their carbon footprint. And in addition to that, telemedicine is expected to grow, reducing the need for uh, travel and in turn lowering emissions. So the pandemic showed us the potential of telehealth to provide accessible care while minimizing carbon footprints. This shift towards virtual healthcare could be the part of a broader movement towards low carbon medical care. And in the end, we're likely to see more integrated health and environmental policies. For instance, some cities are starting to factor air quality into their public health policies to ensure that clean air is seen not only as an environmental issue, but as a fundamental public health necessity. So you as future healthcare professionals can play a role in advocating for such policies that recognize the interconnectedness of human health and our planetary health. So imagine a world where hospitals are powered with clean energy, where healthcare workers are advocates for climate-friendly policies, and where every medical intervention considers not just the immediate health of a patient, but the long-term health of the planet. So this future is within reach, and with your help, we can get there. So lastly, I want to remind you that the power to address the climate crisis lies not only in grand international policies or large-scale government action or just climate activists. It also lies in the powers of individuals like you. You are at the forefront of two interconnected challenges, the health crisis and the climate crisis. So taking action now, whether through education, advocacy, or implementing changes within your own institutions or communities, gives you the ability to influence both. So I encourage you to leave this workshop, I mean, at least my session, with a sense of purpose, whether it's joining or volunteering for a climate organization, starting your own little project or an initiative in your community, or implementing sustainable practices in your particular field. Any step or every step that you take, it will contribute to a healthier planet and healthier communities. You must remember that you are not just the future, you are the present. Your voices matter, your actions matter, and we can create a world where both people and the planet thrive. Thank you, that's it. So if anyone has any questions or you want me to talk more about how you can how you can get involved in the climate space, feel free to ask away.
All right. Thank you so much for that, Lena. Honestly, we could not have asked for like a better summarization of how we as individuals and like future healthcare professionals could integrate the way we approach climate action and climate advocacy. And yes, we do have a few questions, but we'd also like to hear a lot from you about how to get involved in these spaces. But before that, one thing we'd like to ask you is, in your journey through these spaces where climate change has been discussed, a lot of the times conflicts of interest must have arisen, where you must have tried to convince businesses or corporates to like incorporate climate sensitive practices. So, and you must have faced resistance as well. So how has the experience been navigating climate action and diplomacy, and facing resistance from all these corporations that resist climate change?
Yes.
I think there's some internet issue again. You're not very...
Is actually what happened. Oh,
It seems better
am
now.
I audible now?
Better.
Okay. So you might have seen in the news, like it does happen at every conference. Like at all the discussions are made, but no tangible action which is effective or impactful is taken towards this issue. So there's always a resistance from big oil companies or big corporations. You might have seen world's biggest polluters sponsoring these conferences like Coca-Cola, and which is so ironic. And there's always resistance, and the young people even are sometimes questioned in these spaces. So there will always be resistance when you're advocating for the greater good. But I would suggest, if you in future face these challenges, just keep going and you'll get there.
Thank you. Thank you for that. And just building up a little bit more on youth engagement in these spaces. How do our participants and our viewers of this session, how do they find these opportunities? How do they capacitate themselves? And how do they reach a stage where youth engagement is not just tokenistic, but it's actually meaningful? It's amounting to some impact in policy or action, or there's some tangible effect from that.
Yeah, networking is the first step. Like a person can start from getting involved with an environmental organization by volunteering with them, and then speak up. Speaking up is really important. Like you can use
for the past, like, I think 10 seconds. So we kind of
okay,
lost.
so okay, yeah. So I was saying that social media is a really great tool that you can use. Use LinkedIn. LinkedIn is your best friend. So reach out to people, ask them for opportunities, or even there are a lot of pages that you can follow. Follow environmental organizations pages. They often post opportunities to volunteer with them, or even work with them. And even I share a lot of so feel free to reach out to even me. You can reach out to me. I can provide you with a lot of opportunities to get started with. So, yeah.
Incidentally, I'd like to mention here that I found Lena through a common LinkedIn group where I think it's the United Nations Climate Change Group. And that's where I found her and her work on advocacy and climate policy and all of that. And so I 100% agree. LinkedIn is a gold mine when it comes to exploring opportunities, especially in the climate space. Lena, you also spoke about how we need to collaborate more with, let's say, healthcare providers, as healthcare providers with other spaces. So how do you advise our medical students? How do you advise them to go about that and find spaces for collaboration? Because a lot of the times what happens is, especially in our colleges or in places like India, it's a very narrow focus towards our field. We focus entirely on clinical medicine and evidence-based medicine, and there's not much space for exploring intersections and collaborations. So how do we go about that, and how do we build these networks with other professions, obviously?
Yeah. So if you're starting an organization, an initiative, or even if you're planning on starting just a social media campaign, the thing is that you can reach out to environmental organizations. Organizations are always environmental organizations are always looking to address intersectionality. Like, they are willing to collaborate with people from different sectors and see how it intersects with the climate space. So in order to collaborate, like at our organization, at this point, we do receive collaboration requests, but like initially when we started, we did reach out to a lot of other organizations to partner with. So that's the only way to collaborate, I guess.
Right. Thank you. That helps a lot. And we also, since we are talking about intersection, what do you have to say about the fact that like vulnerable communities, there are communities from, let's take displaced populations and informal settlements, there's women, and a lot of other people who are disproportionately impacted by climate change. So how do we go about the process of empowering these people, especially the ones from the lower socioeconomic strata? And how do we build resilience in these communities? Because mitigation and adaptation, interestingly, I'm going to drop a little teaser, a little bit of a trailer here. We are planning an activity that's going to sort of help in building some sort of health education and adaptation and mitigation in informal settlements, and a little bit more on that the next month. But how it's actually a very difficult process to understand how to help empower them. So what is your advice about empowerment of these vulnerable groups?
So I'd say climate education again. So not just as a cure, like not only helping these communities after they have suffered from these crises, climate education can help prevent them from suffering from these climate crisis, I'd say catastrophes. So, for example, even if people from a remote village are informed, like to evacuate a space because there's a prediction that that particular area is going to face a disaster, a climate-induced disaster, for example, floods. But it's really difficult to convince them to really do that. So I believe that climate education and awareness, if they're already informed about the climate related risks, it would not only help them, you won't even like, there wouldn't be a need to uh, cure the problem, sort of. So it will be prevented. The whole situation can be prevented through climate education.
Right. Thank you so much for that. We'd like to tell our participants, if you have any questions, please keep dropping them in the chat box, because from our side, there's a lot of questions. Since we work in public health, we've done a lot of climate campaigns in the past, so we have a lot going, but do not let that stop you. Please drop your questions in the chat box. And Leena, just while our participants prepare their questions, just if you could tell us how you started your journey and what exactly was the spark that drove you to completely enter this space, and how has it been so far? Like all the conferences that you've attended and the whole journey, how has it been?
So how I got started is quite a long journey. So to sum it up, I have always been a kid who was drawn to nature. Like really, I was really connected to nature since the beginning. But since I was born and brought up in Delhi, so since I was a kid, I was very young, so I faced a lot of challenges related to air pollution. As you all might already know, the situation of the air quality in Delhi. I it was really hard to understand as a kid. Uh, like the climate crisis wasn't even a buzz at that time. So as growing up, I faced a lot of situations which keep drawing me to this space. But then eventually, when I faced a situation, like there one time I met a small business owner who was completely uh, unaware of the carbon footprint his business was producing. Like uh, like this example does touch on the intersection of health and climate crisis, because that business owner was like, they were serving and providing hot food in single-use plastics, which is not just harmful for the planet but also people's health. So like they refused to understand the scenario. So, which really shocked me. So then I decided to start my own initiative, which then later on turned into an organization, a nonprofit. So that's how I got started. And eventually I got into the advocacy space during the pandemic. And how has my journey been? It has been a roller coaster ride, I'd say. Uh, Definitely did face a lot of challenges, like you mentioned, a lot of resistance from corporations and the big oil. Uh, but yeah, it does keep me going. So like this year, the effects of climate change were even more tangible. Like the amount of heat waves that we have faced in our country, that was like a reminder for me to keep going. Not just for me, but a lot of people. So yeah, that keeps me going.
True. The continually escalating crisis is honestly, like you mentioned earlier, it even contributes to climate anxiety and eco-anxiety, as it is called, which is another focus area that we have here at SCOF, which is mental health. But a little bit, one last question from my side, Reena. You mentioned about policy making and the role that advocacy can play. So, to you, what does successful youth engagement in policy making look like? And what are some initiatives, like anything that you've been a part of, where youth has been able to influence some change in policy, which has had a positive long-term impact?
So, policy advocacy can be effectively done through attending these conferences and by being a part of like COP. But it's also need to be understood that you need to have a purpose to attend a conference like COP at first, because it's really overwhelming for even for people who have been attending these conferences and have already been working in this space. So a, a detailed research before attending these conferences uh, is really important. Like go through all the UN agencies websites. A lot of information is available there. And speaking of my work in the policy space, um, I have also done a lot of research work. For example, I have co-authored a youth stocktake report. It talks about youth inclusion in the UNFCCC processes. And I have also done research work on a few universities, like how sustainable are their campuses. And I have also, as a public speaker, spoken about uh, a lot of sustainable policies that can be adopted at a lot of these conferences. So those are some examples of that.
Right. And just again, I said it was the last question, but I just have one more. You've been involved in the national and international scene when it comes to climate action and advocacy, and you have, like, the outsider's perspective, since you've been to so many of these international events, and at the same time, a lot of your work is based, like, it's groundwork. You work at the grassroots. So, what does the future look like to you when it comes to the climate action and combating climate change, nationally as well as internationally? Where do you think the world is going? And should we be optimistic? How do we approach it?
Yeah, so uh, my work is basically at grassroots level internationally. So, like, for example, I mentioned the chapters we have. So, each group is working on grassroots level uh, internationally. And I believe since the pandemic, it's a borderless world. Uh, it's a global issue. Like, even though global north is not as vulnerable as the global south, but the whole world is facing uh, this crisis, no matter what the intensity is. So uh, it's really hard to be optimistic at this point of time, but uh, be optimistic in the advocacy work that you might choose to do in future.
Thank you so much, Lena. Shambhavi, would you like to take over maybe? I think that brings us to the end of the questions from our side. And yes.
So I think I'll keep this space open just for our packs to, send in any questions that they might have in the chat. And while they go through that, I'm just going to, sort of summarize what we've talked about. And I think I'd start by saying thank you so much, Lena. Thank you for coming. And it's been wonderful hearing your perspectives and listening to your journey and understanding how we can, become strong climate advocates ourselves. And especially, I think the intersection of climate and health is something that we love working in SCOF, and MSCI has had a lot of work in that space for a very long time. And I think we're all energized after this session to, be very enthusiastic about the work that we're going to do in the coming months. So just to summarize what all we discussed, we went from, meaningful youth engagement. We talked about policy literacy. We talked about how exactly climate change and, as I love to use the term butterfly effect, with the small changes that happen in the climate, they have effects on health, and how that can, affect the sustainable development goals that we talked about, and how the 2030 agenda is so intricately linked to health at all levels. I see a hand raised. Drashti, do you have a question for Lena?
Hello, ma'am. Firstly, the work you do is just amazing. I just had a question that you mentioned about writing and poetry, and the first thing that you said was you should know how to, make like say real life stories that you have experienced. So, could you give us like an example where you might have used it, or like how does it come handy, or something like that?
Just to be clear, your question is like how we have used like poetry as a tool for climate advocacy. Okay. So not just poetry, but a lot of artistic mediums can be used as a tool for climate advocacy. So a few days later, I'm organizing an event during New York Climate Week. It does talk about a lot of ways how you can use art as a medium for climate advocacy. Like a lot of people, including me, write poetry about climate change. So, and even for disabled people, uh, a lot of artistic mediums can be a way for them to understand the climate crisis. So even artists can get involved in this space.
Thank you so much. I think that's really wonderful, how you brought up how, we can use art as a communication media for, people who have intellectual disabilities, and we can work in that space. I remember there was this really wonderful art exhibit I saw at the National Museum earlier this year about, people with autism and their art. And there was a lot of, I could sense the climate, anxiety, the eco depression sort of coming through, and you could see those in the images that they had drawn. And it was quite an interesting sort of, it's a sort of connection to health that is not very apparent at the start, but it does, once we start delving into how health systems are structured and how health affects climate and climate affects health, it comes very it comes after all of that. So thank you so much, Lena, again. I think that is all for today's session. If we do not have any more questions from the participants, which is a slight nudge for them if they would like to ask anything, to raise their hands now. I think we can wait for 30 seconds.
And we would also like to request all our participants to turn their videos on so we can take one picture with Lena.
one really quick photograph. I'll just remove the pin so that we can all yeah. So that's great. Okay, should I take? I think Heath, Avanti, Aryan, we can wait for you guys to turn on your cameras. Nikansha, Siddhi. Great. So I'm gonna take a screenshot in 3, 2, 1. Smile with everyone. Great. That's our photograph. That's been our external speaker session. Thank you so much, guys, for tuning in. And Lena, again, a very, very warm thank you, a very deep thank you from all of us. I'm sorry, I think my internet went off for a little bit, but I think our enthusiasm is there in the way that we're all excited and ready for our sessions at Pune, and this has been a great primer for it. Aradhana, would you like to say something?
Just expressing our gratitude for taking out time, hearing about your work and your advocacy and your efforts has been very inspiring. And it's sort of like reinfused us with the passion and the enthusiasm that we need to make not just this workshop a success, but also to actually catalyze all our members and all our participants into climate leaders. So yes, that's it from my side. Shambhavi, you're not.
Thank you so much for having me here. It was really a pleasure having these discussions with you all.
Yes. So yes, thank you once again, participants and Lena. I believe that brings us to the end of the session. And yes, we will be staying. We request the participants to stay back for 5 minutes. We will be conducting a debrief.